she decides.
She decides, oh na na na. She decides, oh na na. She decides, oh na na na. She decides, oh na na.
Asanka yeka manakazi, osamukomerera we. Asanka yeka.
Despite efforts to address sexual and reproductive health rights and needs among adolescents and an improvement in the contraceptive prevalence rate among unmarried youth in Malawi, teenage pregnancies continue to rise. The trend is particularly high among the vulnerable young people in the country. Against this background, FPAM has been implementing She Decides, a project aimed at advancing the health rights of women and girls and promoting gender equality, and delivering integrated reproductive health information and services.
In Malawi, we have several categories of people. We have people who are living in the urban areas, and for them, in terms of access to health care can be much easier. But also we do recognize that even within the urban areas, there are people who are not able to pay for the services. And us as an organization, because we recognize that we also provide free services through our outreach services, which are both in urban and the rural areas. And when we talk about the rural areas, a number of challenges are facing the people there. That's why we call them marginalized. For example, access to services and also availability of those services, even where there are health facilities, but it's not always that the services are there. And FPAM takes the services there so that every time somebody wants a service, they are made available to them. And the other category of marginalized, we're talking about young people. Young people, usually, they do not have access to these services. One, because probably the environment, getting access from the health facility where their mothers, their uncles are there, usually they don't feel comfortable. So for us, we provide that environment which is very conducive for young people to access those services, which this project, the She Decides project, has been part of the initiative for us.
Evidence suggests that lack of access to SRHR and HIV information and services that engage informed choices among youth, particularly girls, put their lives at risk. Unwanted teenage pregnancies and contraction of sexually transmitted infection affects social development of the youth.
So abona vanhu vakanditumira mazvi mwana achita vichi apyoka mbwenu nkhiza usakamtora kuti naikura mboka fika kuraona vochitika vanyaka vira mbwenu nekuti kwari naini kuti ajoina kuyesha kumukalipirira mukwari kumukanira mukwari noti kamwana kapulikia muguru ranyakira kanjira mwana mbwenu ndimsoka kasangira kuti kana nthumbu kuti vana varekere munhu owoneza yakupuya kupulikana yaye panyumba ndimnangu ndirapo kuti uyu ngawera mbwema shozhose akamsangirako kweni kura so ndivikanana vangati ivi vakupangisikanga kuti vana vai vakulongosoka makora cha wavhurika kwasuku kuti vana vangavhurikira so sokunyenguya sono kuti vakulera mbwenu kukhala kukhumba kuti mwana so ndikhale nawo pasi patakhala nawo pasi mbwe vachitevi vanje vatore kulera mama kuti vasambire makora vapitirije vari kusokonezeka sukuru cha.
While most girls in the country are not given much chance to have their choices on family planning services and sexual reproductive health and rights issues, those that have been impacted by the She Decides project attest that they have made right decisions.
Kwitu tikotana 5 mnyeke walipanyumba kwamba wakalaka washirira ogera ntchito kumzuzu ine wachitatu ni form 3 wachinayi alipo al form 1 wamaliro walipanyumba kweni wana nthumbu chifukwa nja kuti inapa ngamba kugwisa ntchito ngasangana ngakumana na ujeni wa FPAM so akatwasambizi kambwenga na kuti apana nisombwe ivasambizi apo vuwembi wakupafyana na kulera mbwenga zakamba kulera so iye akalelanga chakakhalanga waka akamayanga chicho sitaleka sonona nthumbo.
The project targets vulnerable people in the hard-to-reach areas with sexual reproductive health services. Clients that have accessed services at the FPAM outreach clinics have had a change in their lives for the better. According to the FPAM manager, through the She Decides project, the organization provides the needy high-quality sexual and reproductive health services free of charge in order to provide women and young people choices on how they plan their lives.
As FPAM, we counsel, we provide services, especially to the youth, because as I've said, this is a youth life center, so we might focus on the youth. We provide counseling, we provide HIV and testing, we provide ART to those who are positive, we also provide family planning, and those who have got general medical cases, we also do help. As the word she decides, a youth has to decide when to be pregnant or not to be pregnant, but the pregnant has to not be unwanted. She has to have that wish. She has to say on herself, on her future education, and how to protect herself from STIs and pregnancy. So she has to decide. Nobody should decide for her, but she has to decide.
FPAM utilizes the youth in order to reach out to the fellow young people in order to express themselves as active participants in decision-making processes. Youth Action Movement, YAM, is an independent youth wing of the organization. The She Decides project utilizes the wing to spearhead sexual and reproductive health among the youth.
This project, She Decides, is playing a big role, whereby it is much involved in carrying information into hard-to-reach areas. Yeah, so we are the message carriers, in short I can say so. We have different ways which we use. For example, we do go out in outreaches, so whereby we meet people in their respective areas, and we also use a radio, which is a community radio. We do go there on a certain program. We talk about what we do as YAM, and in relation to the She Decides project.
She Decides project equipped the youth with social media skills to prepare them to conduct peer education and aid social dialogue on family planning information and choices on fellow youth. The youth are also engaged in providing crucial messages.
Okay, madala ineyo rundi mafuna ndingo kukumbusani ngene jande na kubasanija muna longo sola
ngene jana longo sola plus
muna vaya ku hospa
luna vala so plus wiki na vaya
nde banje zinateka banje nakuthandizani banje madala.
Okay, ndinafika nandindizi mantha ndinarake bomaziwa ere hapa nchanake
Yeah.
Ya namba ulongo solera boka mumene zikozokhalira chasolusa kakazunduja ka fomu ya sayira ndakatenganawo toyera magatira safety ola
Yeah.
Being a social media agent, it means that you advocate for SRHR and also for office FPAM as well as YAM, but through social media platforms. I'm talking about Twitter, Instagram, Facebook, and WhatsApp. For Facebook, it has been so impactful because the messages reach young people easily, and also we see through feedback that we get in our inboxes when we post something or share something. It was very necessary because first FPAM targets young people, and also moving in technological world. So many young people are busy with this technology through these platforms. So it was very important for them to have these social media agents because we can easily reach their target.
The youth are also engaged in providing crucial messages about family planning through the media. Bembeke FM in Dedza partnered with FPAM in order to provide space for the youth to provide relevant communication to the community on reproductive health.
So kwa achinyamata kuchokera ku Youth Action Movement mmene mukugwirira ntchito ndi FPAM iniyo ndi nthambi ya FPAM mukuyithandiza bwanji FPAM kuti ikwaniritse zolinga zawo?
Ndi maudindo ambiri amene timagwira FPAM kuti anthu ena akuluakulu sangathe kufikirapo. Iwo aja akuzongoti tumoti lowera ni area yako kuti tamva uthenga kuti mwina achinyamata kumeneko sakupita ku school. Komanso kusapita ku school kumathandiza kwambiri kuti anthu ena azingopanga michitidwe ina. Fota akapita ku school kujamalandira be malangizo ndi uphungu wina woti mukhoza kupanga izi mukhoza kupanga izi. Koma ngati munthu sakupita ku school angokhala pa khomo timakhala ndi mwayi wina woti mukhoza kukhala ndi zibwezi zingapo. Komanso kumapanga michitidwe ina. Ndeti kakhala kuti feda mpotenga ngati umeneyo timapita area ngati imeneyo ndikupita kukakambirana nawo achinyamata aja kwasonkhanitsa pamodzi kuwafotokozera ubwino woti mukhoza kutsatira njira zakulera.
According to the youth that patronize youth line clinics at various locations in the country, the organization provides youth-friendly services. These services have resulted in seeing a significant number of youth accessing various services.
I met this other girl, some herself blind here in Zuzu. The girl seems to be ignorant. She doesn't know anything about cervical cancer screening, about STIs. So I was telling her that, okay, I went to FPAM. There's this other family planning association in Malawi. If you can go, at least you can live a better life. Because she was saying, I'm young, but see, I've got 2 kids. I don't know now with these things, cervical cancer. I don't know where I can go so that I can say, and I can access my services. I told her, go at FPAM, as young adults. We need people who can talk to freely. We go to the hospitals, they shout at us, why are you here? You are young, and why doing this and that. But if we come here, they welcome us very well. The services that we need, they give us. And we are free to chat with our fellow youths here at FPAM.
FPAM clinics countrywide are known for their integrated approach to health services delivery. The integration entails that all services are accessed at the same place, cutting on time spent by clients visiting various departments offering specialized care.
FPAM provides integrated services. When you're talking about integrated services, we mean so many services. When you talk about SRH, sexual and reproductive health, it's a package, but within that there are some components of services like STI management, HIV management, cervical cancer screening, gender-based violence. So all these services, they are components of services within the SRH package. So all these services, when a person comes to a room, a consultation room of a service provider, he or she should be able to get a number of services in the same room, not going to. This has helped to minimize the queuing of the patients in the clinic, and also when a client comes, he spends less time than he could go to other rooms, because you see, this person needs to concentrate on other development activities, but then instead of receiving a service in a day or in a single room, we find that he goes to a clinic on Monday because the services are being provided on Monday.
In order not to leave out any of the people that may want to access the various family planning services demand, creation activities are carried out. Communities interact with health services providers.
ndentambosamba ndaona kuti amene nasambamo ndikuti abafunika kuti ndipange njira yolela kwana zoti mwanayo ndilumbize ndendabayitsaka ijekiseni tabetse jekiseni mwezi utakwana okabayira ndendawazone kuti koma jekiseni ndiona kuti nikhala nchinchiro wambiri walakikitsinokula ndozaka zitatu zocheperapo basi ndiye kuti ntakitsinokula nditakachotsa pamene ndzakhala maganizo obereka wina ndazizode kuti nufulu ifo yonena kuti omunangolo kuthoka banje sikuti wanawo khuzuka nithandiza mwini usamala because makavutika naoneka.
Provision of information enables families to make informed decisions of family planning. The She Decides project also encourages the involvement of men in encouraging women to make decisions on the uptake of family planning methods. Manageable family size is crucial in the development of communities.
Wakava kwenda mpaka kumaningana kuti program nji ilisogeza wani pale tunatora mbongo tavuzi vile ni makora mbweni vingana namu tingapaka namtika tumbisika naso na mkanga uti mandongo sorira swap mbwe kutambwe vile makora waka uchupa kali nasono vapambana kababiro kasoro na kali vapambana to kali tika ubaba mwakupulika mvakarumiki sananga kweso ndikumboti na muizi na mu vakarongo sorira banyani mungu tambwe vile makora uti bavengi kugapu bana bakupambana 5 years 6 years.
Youth line clinics have been a reliable source of quality health service for the youth and the entire community. The clinic offers post-abortal care services for youth and mothers.
Ndio nanaza pita kwao ndenta pita kwa kuja tinkajeza nalo zone kuti anje digonane ndena muzone kuti asira sizothenga zimezo nakalipa school ndio janane kakamisabe nkobeze zone zitu zijene nkubanga kenako nkobeze kuti mwezi wene sinapange video napita kwa chipatala ndabo ipata kuja ndanani yeza nkobeze zone ninja ni mimba yakena kutuno jana kuti kwa kugwanga ina kwa nini basama nkwala odi nikamwende kubafa ina kutaka mama nkhalaja bana bezizone kuti mima magama ambo wawa kena kuna mpaka sama kazi mampafu ndentara magazi banje na bezone njone mayanga nani tiwa ara ni tiwa jana tabro kujibarana FPAM ikwana naka nikulia mankwala kumamwa kena kuone zoti moyanga bambuka sumini nakalira gani bodolo bineli sili ligana kalo lo savuda chikananga ndikuisa chilenjira sakulera.
Unwanted pregnancies and unsafe abortion are common among vulnerable people. This is often due to lack of choice on behalf of young and vulnerable people. Parents and leaders in the community have a key role to play in order to make decision-making easier for youth on family planning.
Usogolo kutofunika zoti nanga